Hello, my name is Delvis Rodriguez Abreu. I'm a medical oncologist from the University Insular Hospital in Canary Island, Spain. And I'm pleased to share with you, on behalf of my co-author today, the final analysis of the KEYNOTE-189 study. As you know, the randomized double-blind phase 3 KEYNOTE-189 study compared pembrolizumab plus pemetrexed and Platino versus placebo plus pemetrexed and Platino in patients with non-squamous, non-small cell lung cancer without EGFR or ALK mutation, regardless of the PD-L1 expression. I would like to say, after a median follow-up of 10.5 months, it was the first report that we did with the KEYNOTE-189, we demonstrate an improvement in the progression-free survival and overall survival. The overall survival, the hazard ratio was 0.49 the first time. And for progression-free survival, the hazard ratio was 0.52. It was in the first analysis. But right now, we are going to present the result with an additional 18 months of follow-up of this study. We can say that the median overall survival was 22 months in the pembrolizumab arm compared with 10.6 months in placebo arm. You know, the overall survival rate at 12 or 24 months was also improved with the pembrolizumab arm compared with placebo arm. Yes, it was the most important thing for me. The improvement in overall survival and progression-free survival in this study was in all subgroups, even with patients with negative PD-L1 expression. And it's the most important thing because all the patients included in this study get an improvement with the combination with pembrolizumab plus pemetrexed and Platino compared with placebo plus pemetrexed and placebo arm. The progression-free survival was 19 months compared with 4.9 months in the placebo arm. And it was in all the subgroup also, even in the PD-L1 negative subgroup. But also an important thing that we present for first time with this study, it was the progression-free survival 2. We showed the progression-free survival 2 was improved in the pembrolizumab arm compared with placebo arm. The median progression-free survival 2 was 17 months compared with 9 months in the placebo arm. And it is important because you can say that even in those patients we start therapy with pembrolizumab, after the progression, they still getting an improvement in the second and subsequent therapy. With these 18 additional months of follow-up, the safety are the same that we present previously, you know, with 72.1% patient in the pembrolizumab arm had grade 3 to 5 adverse event, compared with 66.8% of patients in the placebo plus pemetrexed and Platino arm. It is the same because initially we were worried about the safety. Maybe with longer follow-up, maybe you can see other adverse event that we didn't see before, and it was not. The adverse event was the same as the initial report. We can conclude that pembrolizumab plus pemetrexed and Platino continue to demonstrate an improvement in overall survival, progression-free survival, and response rate in all patient subgroup independent of the PD-L1 expression. We can also conclude that pembrolizumab plus pemetrexed and Platino had a manageable toxicity profile, even with this additional follow-up.